How long will this take is a diff- how long will it take is different for each person. Some side effects may not go away at all. If you start to feel upset or sad or how long treatment is taking or the side effects you have, be sure to talk to your cancer care team. They can help you with side effects. You already know about nausea and vomiting. Hair loss. Some chemo can make your hair fall out. You may lose your hair on your head, face, arms, armpits, and groin. You may lose your hair slowly or almost overnight. Not all chemo drugs have this effect. Some only cause the hair to thin out. Your cancer care team can tell you what to expect from the chemo drugs you're getting. In most cases, hair grows back after chemo, but it may not be the same color or but it may be different in other ways. Ask your team for tips on taking care of your hair, scalp during chemo. Some people choose to wear head covers such as caps, scarves, turbans, or wigs and hairpieces. Many health plans cover the least part of the wig or a hairpiece. Also, you could deduct these costs from your income tax. Bone marrow changes. The bone marrow and the liquid inner part of some bones is where your blood cells are made. Red blood cells and white blood cells and platelets. It's often affected by chemo, which can cause your red blood cell count to drop. Red blood cells carry oxygen from the lungs to all parts of the body during chemo. The bone marrow may not be able to make enough red blood cells. Not having enough red blood cells is called anemia. This can make you feel short of breath, weak, and tired. It could also make your skin, mouth, or gums look pale. White blood cells. Chemo lowers the number of your white blood cells, which makes you less able to fight infections. Your cancer care team may suggest ways to stay safer from infection, such as staying away from people with colds or fevers, staying away from crowds of people, and washing your hands often. Platelets. Form blood clots that stop bleeding from cuts or bruises. If your bone marrow can't make enough platelets, you may bleed too much, even from small cuts. If your platelet count is very low, you will need to be very careful. Even brushing your teeth too hard can make your gums bleed. You may need to use a soft bristled toothbrush or one made from foam. Check with your team about flossing. These effects on the bone marrow will not last long. Blood tests will be done to see when your bone marrow is making new blood cells again. There are treatments that can be used in your blood cell count gets too low. Mouth and skin changes. Some chemo drugs can cause sores in the mouth and throat. Good mouth care is a key part of treatment. Be sure to brush your teeth after each meal. Try to see a dentist before starting chemo. A dentist can show you the best ways to take care of your teeth and gums during treatment. Some people have skin problems, such as redness, itching, peeling, dryness, and acne. Most skin problems are not bad. Some need to be treated. Some people are allergic to chemo. This can cause hives, itching, or trouble breathing. Chemo is usually given in the doctor's office or clinic when a nurse can watch you for this type of problem. These problems must be treated right away. Ask your cancer care team for both and taking care of your mouth and skin before and during chemo. If you have any side effects, tell your team about them right away. There are often things you can do to help you and keep the problems from getting worse. Changes in your sex life. Well, I'm single, so I'm not going to read about that. Fertility problems. Some chemo drugs can leave you unable to have children. This effect does not always go away after treatment ends. If you think you when I have children someday. Tell your doctor before you start treatment. Memory changes. Cancer and its treatments can affect your memory and thinking. This may be called chemo brain or chemo fog. In rare cases, it can last for a long time after treatment. This happens more often in treatments that uses larger doses of chemo drugs. If you notice this, talk to your cancer team. There are health care workers who could help you with thinking exercises and other types of treatment to help these effects. Emotional changes. Chemo and cancer can affect a patient's emotions. Chemo changes your normal life. It can make it harder to get things done. You may feel sad or scared. There may be some strain on how you get along with others, but there are ways to cope with these things. Talk to your cancer care team about counseling, support groups, and things you could do to help be less stressed and more relaxed. Your friends and family could help give you emotional support too, but your loved ones may not be sure how to talk to you about cancer and chemo. It's good